Hi, I'm Dr. Premila. I'm a pediatric dentist and practicing exclusively child dentistry since 2009. Children. Causes of cavities again is different depending on different age group. Nowadays we are seeing a large number of children with early childhood caries, where we see extensive cavities in very young children, like 1.5, 2 years. The main cause for that is either breastfeeding or bottle feeding beyond 1 year of age. Yes, WHO does say that we need to breastfeed a child beyond and up to 2 years at least. But this is seen in children who suckle purely out of habit than hunger. So what happens is the sugar in the milk is in touch with their teeth for a longer time and more frequently, demineralizing their teeth, that is weakening the teeth and thus causing the cavity. In older children, the cause would be diet. Again, there's a misconception that the main cause for cavities is chocolates or sweet. That's not true, because any sticky carbohydrate, let it be your chocolates, let it be Oreos, biscuits, even something as safe as chapati and jam. So I'd advise parents that whenever you're going out, carry a healthy snack like a fruit. When you're at home, child can have whatever he wants and then quickly clean the child's teeth up. The other reason is if the tooth developmentally is prone for a cavity, especially our molars have a lot of grooves. So if they are deep, then the child will get cavity easier than the other child. And one very rare cause is genetic. Sometimes developmentally child may have a defect which would make the teeth more prone. As parents, we are always concerned about dental treatment, especially. Sometimes we do see the cavity, but we start thinking, is it the right age? Will it be too painful? Will my child be able to handle the dental treatment? But so what parents need to understand is that dental caries, especially, is a very progressive disease. So once it starts, even after a month, it's going to be in a much worse situation than what it started with. So as soon as a parent suspects the cavity, it is better to get a dental checkup done. Now, the different treatment for cavities would depend on the extent of the cavity or how deep the cavity is gone. The first stage of a cavity is something called as white spot lesion, where there's very early sign where there's a whitish area in the teeth. Especially the upper front, but you do see it in the molars also. But this stage, there's no extensive treatment required. There are remineralizing paste available. If we could apply it regularly, that would strengthen the teeth. Tooth basically is divided into 3 layers. There's the enamel, there's the dentine, and there's the pulp, which is the innermost part of the tooth. So as long as the cavity is in the enamel, we can clean it and fill it, what we call as the restoration. Most commonly used material for children is glass enamel cement, but there are other like Miracle Mix, composites, contomers, or sometimes even we need to put a crown or a cap for such small cavities. And then is when the cavity reaches the initial stages of dentine, we can still clean it and put a restoration or fill it up. But as it starts going closer to the pulp, that's when we will have to take an X-ray to see exactly how bad the cavity is and decide on the treatment. So once it reaches the pulp, we have to do something called as a pulp therapy. That could be a pulpotomy or pulpectomy, depending on how deep the cavity is. So we may have to numb the tooth with a local anesthesia, clean the pulp up depending on the extent of the cavity again, fill it up with a filling material, and later crown it.